Hello, hi, I'm Damiano Barone. I'm a neurosurgeon working at Houston Methodist. I specialize in functional and peripheral nerve surgery, and I lead an academic lab working on development of novel neural interfaces. What we're trying to discuss today is what stops neural interfaces from being effective in the long term, for the lifetime of the patient. And there are multiple issues, but one of the main ones is foreign body reaction, or as is known in the field, FBR. Foreign body reaction is a physiological response in any living organism. How to think about it? So the body needs to defend itself for anything that enters it. This can be a small bacteria, it can be a bigger parasite, or can be any non-living things like a chip of wood inside, or implant inside the body. Now, if you have a small bacteria, then what the body does is activate the immunological process that eventually ends in having a white cells, a macrophage, bringing the parasites, the microorganism inside and destroying it. However, when you start having a parasite, which is order of magnitude much bigger than the bacteria, then the small white cells is unable to do this process of phagocytosis. So the way that the body has evolved to protect themselves from the parasites is, okay, we cannot, the white cells cannot eat the parasites, but at least it can exclude from the rest of the body. So the cells start surrounding the arm of a parasite and start secreting extracellular matrix and scarring that basically goes around and walls off the parasites from the rest of the body. Now, this mechanism exists, and this mechanism is the same that applies when we implant something in the body. Now, I say this physiologically and not pathologically because it's not always harmful. I mean, that's the way to protect ourselves from, from parasites, or from, for example, a piece of material that is stuck inside that we don't want to get infected. And for some implant, medical implant, think about breast implant, knee implants, it actually can be even useful because it keeps the implant in place, having a minimal degree of scarring and walls around. However, when we start talking about electrical implants, then it becomes a problem. And let me tell you why. So if we have an implant, so this is our contact, this is our electrodes, and this is our nervous tissue. What we want to happen is to have a communication between the two. We want the electrode able to stimulate the nervous tissue, and we want the electrode able to record from the nervous tissue. And the best way to do that if they are in contact to each other, that the distance between the electrodes and the nervous tissue is as small as it can be. However, if foreign body reaction happens, scarring starts coming in between the two. The more the scarring, the higher is the distance. The higher is the distance, the worse is the signal quality. And eventually there is such degradation that the contact is completely lost. And that's one of the first problem, loss of signal. But the way that this process works, the immune system doesn't just want to exclude the parasite from the body, it also wants to kill it. And the way it does that is by producing a negative environment inside. So everything inside this capsule becomes very acidic. And this acidic environment, it's definitely bad for the parasite, but it's also bad for the material in itself, which cause over long term degradation of the material, perishment, and eventually malfunction. So the process itself is not ideal, and is what stops the electrodes from working in the long term. So let's go a bit more on the details of how this progresses, because if we really understand how foreign body reaction works, then we can start targeting some aspect of it and try to reduce it. The first step of foreign body reaction is the insertion of the electrodes. Every time we implant something in the body, we cause a degree of trauma. It's implantable, we have to open, so we have to put in the tissue. The tissue can be brain, can be spinal cord, can be nerve, can be anywhere in the body. We will cause a degree of trauma, which eventually will cause some of the vessel to lose some of the material inside to go outside. So this can be platelets, can be proteins, can be immune cells. All this will come outside. So if this is the implant, the first thing is going to happen is that you're going to have a first layer of protein coating. So all this protein that come out from the blood start coating the implant and making a target for what comes next. And what comes next is the first round of cells. The first round of cells are usually neutrophils, which is another type of white cells in the blood. And those cells start going and making another layer and attaching to our implant, which is now being protein coated. So after neutrophils, macrophages steps in, and they are very active cells. They cannot go through phagocytosis because the electrode is too big, so they use the same mechanism they're using for parasites, and they start trying to engulf the electrodes. And they do that by starting secreting cytokines, in particularly pro-inflammatory cytokines. One of the most important is interleukin-1. So by secreting these cytokines, they start activating another group of cells, which are the fibroblasts. The fibroblasts, they live in tissue, they get activated by the pro-inflammatory cytokines, and they start producing the main components of what they will make the capsule that is around the implant. The capsule is made of collagen. Just to repeat, the protein attached to the electrodes, the macrophage will attach to the protein, they will start secreting pro-inflammatory cytokines, which will activate the fibroblast that eventually will secrete the collagen. And the collagen start making that thick capsule that goes around the implants, the scarring that goes around. And this process starts rapidly, eventually stabilizes until there is enough thick capsule that the body doesn't sense that there is an implant anymore. So these are the different stages of foreign body reaction. And it's important to understand them because then we can apply different strategies to try to diminish and reduce the amount of foreign body reaction and then therefore the thickness of the capsule inside. So there are three main strategies that we use in fighting foreign body reaction. And we use this strategy either on its own or in combination. So one strategy is to work on material, how actually the material affects this process. Another one is working on surface or topology, and another one is working on the chemical side of the process. So material. One thing I said is this is a traumatic process. And what we found out is that the more trauma is caused to the tissue, the more foreign body reaction is there. Probably because there is more stuff coming out from the vessel. Maybe there is more protein coating. Maybe there is a bigger inflammatory reaction. But we know that more the implant is traumatic, the more scarring is produced. So the one way that we can do that, we can use that bit of knowledge to reduce the scarring, is by having material that is either softer or more flexible. We can work on the material, we can make it more flexible, softer, and we have produced pieces of research showing that by doing these changes, scarring is significantly reduced. The other thing we can do is to change the surface of the material. we know that if the material is more hydrophilic, that will make the protein coating less severe, and again, that will reduce the amount of scarring. But one interesting strategy is to have the material secreting certain compounds. We know that if we use, for example, dexamethasone, which is a powerful anti-inflammatory drug, we can reduce all this process because, of course, it will reduce the amount of macrophages being recruited, the amount of cytokines being produced, and therefore all the cascade coming after that, including the amount of scarring. One issue is that dexamethasone is, yes, powerful and has worked very well, for example, with pacemaker leads, is not particularly good on nervous tissue, and in particular on regenerative nervous tissue. We found that dexamethasone actually stops regeneration, so it's not a very good strategy for neural implants. But in conclusion, foreign body reaction is a big issue. There are multiple things that we have tried, and in particular both to study the process and to prevent and reduce the foreign body reaction. Probably in the future there will be a combination of all the strategies that will allow us to have neural interfaces that not just work, but work for the lifetime of the patient. Thank you.